Hello.
My name is Dr. Muniyappa. Is it Charles Mann?
Yes.
It's nice to meet you, Mr. Mann. How can I help you today?
I got up this morning and the left side of my arm and leg was really weak, and it only lasted for about 30 minutes, and I'm only here because my wife insisted that I told my nurse, because I came for my regular checkup for my diabetes, and she insisted I'd mentioned it to the nurse, and she said I should see you.
Right, okay. And how long ago do you think this happened?
About 4 hours ago.
4 hours ago, okay. And you feel fine now?
Yes, I do.
Yeah, okay. So you mentioned it was your left arm and your left leg that were
Yes.
weak. Were you able to get out of bed, or did it stop you doing that?
It stopped me for about 30 minutes or so.
Okay.
It was really difficult to move, and then it went off, and then I could move about okay.
Okay. Did you notice any other weakness, like in your face?
No, nothing, no.
Okay. Were you able to talk okay?
Yes,
Yeah.
yes.
Has this ever happened before to you?
Nothing like this at all before at all, no.
Okay. Did you have any chest pain at all at the time?
No.
And did you feel your heart racing at all?
Yes, that was racing.
Okay, and that happened at the time that you had the weakness?
Yes, it did.
Okay. And has this ever happened before?
Not at all.
Never. So it was just about 4 hours ago, you woke up, the left side was weak,
Yeah.
but you were able to talk okay.
Yes.
Were you able to see okay?
Yes, vision was fine,
No
nothing else.
problem. You mentioned that your wife was worried, and she's urged you to mention it to the nurse
Yes.
today. Was she worried about anything in particular, or were you worried about anything? Or?
No, I don't worry about that sort of thing, but it was
Okay.
my wife.
Did you have any ideas of what it could be?
No, not really. I'm just hoping that, you can just say everything's okay. I didn't really think anything of it.
Okay. And did you think I'd be doing any specific tests or any specific things when you came to see me today?
Well, probably just kind of a general examination of my heart and all that sort of thing.
Okay.
That's it.
Okay, that's fine. So if you wouldn't mind, I'm just going to ask you a few just general questions just about your general health and how things are at home. So we've got here that you suffer with diabetes.
Yes.
And you also have a high blood pressure.
Yes.
And you're on some tablets for that?
Yes, I take 2 for my diabetes and 2 for the high blood pressure.
Do you take any other medication from over the counter, any herbal tablets?
No.
No, okay. Are you allergic to anything?
No.
Okay. Is there any family history of any strokes or heart attacks that you're aware of?
Well, no. You see, I'm adopted, so I don't know.
Oh, right. So. Okay. Are you working at the moment, Mr. Mann?
No, I'm a retired teacher.
Okay.
And enjoying my retirement.
Oh, good. And you mentioned your wife, so do you live at home with your wife?
Yes.
Anyone else? Anyone?
She's fine, and yeah.
Yeah? She doesn't have any other medical problems?
No.
No. And anyone else at home with you and your wife?
No.
Okay. Do you smoke at all, Mr. Mann?
Not anymore. I
Okay.
used to,
Okay.
but not anymore.
That's good to hear that you've stopped.
Yeah.
How long ago did you stop?
Oh, it's got to be about three years, but I used to smoke for about 20 years.
Okay.
And I used to smoke 20 a day.
Right.
But I thought enough is enough, so
you've stopped now?
I've stopped now,
Okay.
yes.
Do you drink any alcohol?
Oh, very, very little. I leave it to the weekends, and it's only a glass of wine or 2.
Okay, nothing more than that?
No.
And do you mind me asking if you drive?
Yes, I do.
Yeah, and how have you got here to the surgery?
That's how I got here today.
You've been driving. Okay. So just to make sure I've got everything right, one more time. It's the left side arm and leg that were weak this morning. Happened about 4 hours ago. You're fine now. The symptoms have gone away.
Yes.
And your wife's really urged you to come in today to get it checked out.
Yes.
Okay, that's fine. So what I'd like to do now is examine you. I'd like to start by checking your blood pressure again.
Okay.
Just checking your pulse, checking the nerves in your arms and your legs, but also in your head, and having a look at the back of your eyes. Would that be okay?
Yes, that's fine.
Okay. Okay. Well, thank you for letting me examine you. All the checks that I've done today have come back okay, which is good. Okay. However, I am concerned about the symptoms that you had earlier today. I think it could be something called a mini stroke.
Ooh.
Have you heard about mini strokes?
Well, not really. I've heard of strokes, but not
Sure.
mini strokes.
So what do you know about strokes?
That it kind of paralyses people.
That's right.
And it affects your speech and how you think. And they can they improve, but it usually leaves people not what they used to be.
That's right. So you're absolutely right. That's what we class as a stroke. Now, a mini stroke is when you have a temporary interruption of the blood supply that goes up to your brain. And when you have a stroke, it's usually a permanent loss of that blood supply to certain parts of the brain, which is why you're left with weakness or symptoms that persist. But in your case, I think because it was temporary, all your symptoms have resolved and gone back to normal. But that's what we call a mini stroke. Okay. Mm-hmm. Now, mini strokes we do have to take seriously, and I would like you to have some checks done at the hospital.
Oh.
How would you feel about that?
I'm a bit worried about going to the hospital.
Okay.
Yeah. Yeah.
Was there anything you were worried about in particular?
No, it's just everything that goes on around you, really.
Okay. Well, it is a necessary part because we need to get some certain tests done, including some more specific blood tests and also a scan done of your head so that we can see if there's any evidence of these issues with the blood supply. Okay. Yeah. Now, I would also like for you to have a tablet today, something called aspirin, just to help thin your blood until you see the hospital. Would that be okay?
Yes.
So we'll get that for you at the end of the consultation.
All right.
Now, I'm going to make a call to the hospital and ask for them to see you. So you'll be seen today in the hospital.
Oh, today?
Yeah.
Right.
Is that going to be okay with you?
Yes.
Yeah. Now, the only other thing I would say is because I think it has been a mini stroke that you've experienced, we usually say you can't drive or you shouldn't be driving for at least a month or at least until you've seen the hospital.
A month? I love driving.
It is just for safety purposes because in the first month you're at more risk of having a further one of these, and if for some reason it happened whilst you were driving, it can cause an accident and you can hurt yourself as well as other people. So we say at least for the first month. If you go up to the hospital and the consultant says otherwise, then that's fine, but the usual advice is for a month. Okay. Now, we do need to get you up to hospital for the appointment today. Is there somebody that could take you?
My wife, as long as she can get here, she can drive me, yes.
Okay, that's great. Now, just some advice. If this happens again before you get up to the hospital, so there's weakness in your face, any problems with your speech, any problems seeing, or weakness as you described this morning, I would like for you to call 999. It's likely the appointment is going to be sometime today, but I will confirm that with the hospital.
And if that happens when I'm at home, it's a 999 call.
999 call, just because we need to get you checked ASAP.
All right.
Okay.
Thank you.
Now, would you like some information about mini strokes?
Yes, I would really. It's kind of been a bit of a shock, really.
Sure. Okay, I can see that. So I'll print out some information for you.
Yes.
I'll make the arrangements at the hospital. So if you want to take a seat in the waiting room, I'll let you know when that appointment's going to be.
Thank you.
The information that I'm going to give, it may be worth as well sharing to your wife. So if she recognises these symptoms as well, that she'll know what to do.
All right.
Is
Thank
that
you.
okay?
Yes.
Do you have any questions at the moment?
No, it's just taking it all in, really.
Sure.
I probably would have when I think about it, but not just at the moment. Thank you.
If you do come up with any questions, if you just write them down, and I'll make an appointment to see you next week, as long as there's no other problems in the meantime.
Okay.
So you can see the hospital, see what they say, and then we can maybe have a chat next week.
All right, thank you.
Is that okay?
That's fine.
So I'll make those arrangements. Just have a seat in the waiting room.
Thank you.
Thank you very much. Thank you.